My name is Dr. Christina Kramer. I am one of 3 obstetricians and gynecologists here at Cuyuna Regional Medical Center. I've been here for the past 4.5 years. I am a board-certified obstetrician and gynecologist. I'm a native Minnesotan. I grew up in Maple Plain, Minnesota, went to medical school at the University of Minnesota, Twin Cities, and then went out to Buffalo, New York for my residency, and then moved back home to start working here at CRMC. A GYN exam has multiple different components, including examination of the external genitalia, the urethra, examination of the vagina, and then the internal female reproductive organs. So if a woman has not had a hysterectomy, this would include the cervix, uterus, fallopian tubes, and ovaries. And then a woman, if she has had a hysterectomy, the cervix and uterus would be surgically absent, but the vagina and the bladder and rectum would also still be present. And so sometimes that would entail a speculum exam, or what women colloquially refer to as the duckbill thing. Just because a speculum may be used does not mean that you had a pap smear. A pap smear is a specific part of the exam designed to detect cells from the cervix and screen them for abnormalities such as cervical cancer. So the speculum is a tool that we use, but that does not necessarily imply that a pap smear was done. In fact, if a woman has had a hysterectomy, she does not always require a pap smear anymore. And similarly, women over the age of 65 in some cases may not need a pap smear. But a speculum is still an important tool that a gynecologist may use to detect other issues, such as abnormal vaginal discharge, pelvic pain, help detect pelvic organ prolapse, and other things. And then we would also do what is called a bimanual exam, which is an internal exam where the provider would do an exam internally to detect any masses, the size and shape of the uterus, and if there's any enlargement of the ovaries. A GYN exam, it depends on who you talk to, how often that should be done. There's a little bit of contention in the medical literature depending on which kind of doctor you're talking to. There was a big paper in the New England Journal of Medicine within the last decade questioning the utility of a pelvic exam every year from the stance of an internal medicine or primary care provider. Basically, if a woman doesn't need a pap smear, do we really need to be putting them through this uncomfortable exam? Now, you're going to get a biased answer if you talk to a gynecologist, because that's what we do all day. But even if a woman doesn't need a pap smear, I would argue that it's still important to see your gynecologist on an annual or yearly basis for routine checkup. Even if everything is going well, there are some conditions that are benign that we sometimes detect on routine exam that are helpful to catch early, and then we can provide education, counseling, and get a woman into treatment sooner. For example, I would be looking for skin conditions of the external vulva or external genitalia, which may or may not be an infectious or an autoimmune process. We can also detect the early stages of pelvic organ prolapse, or if things are starting to fall down in the vagina, and talk to women about exercises and physical therapy that they can do to prevent those conditions from worsening. So even though you may not necessarily need a pap smear, I would argue it still may be important to see your gynecologist at least every other year, if not every year, to do an exam. I think it's a good opportunity to meet with a gynecologist and have an annual exam and a pelvic exam, if only for us to provide counseling about conditions that are common at a different stage in a woman's life, provide anticipatory guidance, or even things that a woman can expect about her body as it changes as she enters different stages in her life, such as the perimenopause or menopause, and provide anticipatory guidance. The GYN exam is important because I've been able to detect conditions that a few years down the road may have presented more problems to the patient, and we are able to catch things at an earlier stage, for an example, an ovarian cyst or a uterine fibroid, and treat that at an earlier stage to make it an easier experience for the patient. If you had any other questions or concerns about why a GYN exam is important, we would be happy to visit with you in the office or even over the phone to discuss what we would maybe be doing, and also hopefully put your mind at ease. Patients are able to call our office directly and get in for an office visit, whether for a well woman exam or a problem visit, and a referral is not required.